I'm June Gruber, an associate professor of psychology at the University of Colorado Boulder and director of this mental health expert series. I'm excited to be here today with Dr. April Thames, an associate professor and clinical neuropsychologist in the departments of psychology and psychiatry at the University of Southern California. So thanks for being here today.
Thank you for having me.
I was wondering, April, if you could start by just saying a little bit about the kind of mental health work and research that you're doing.
Sure. My work is really largely focused on outcomes, and I have more recently been interested in aging outcomes for both cognitive and mental health, and trying to bridge the relationship between the social context, what things are happening in the social environment, and how that interacts with biological processes to influence these various outcomes. So more recently, I've been doing work around socioeconomic disadvantage, as well as discrimination and racism, and looking at how those social factors have an influence on both cognitive and mental health.
How did you first get started doing this just incredibly important line of work that you described?
Well, it was not a clear-cut journey. I first started having an interest in brain and behavior relationships, and that's sort of what pushed me down the clinical neuropsychology track, and recognizing how much that disease as well as mental health, they really go hand in hand, and cognitive processes and how those may deteriorate as a function of disease. I started there and then recognized that I was studying an HIV infected population. So many of the people who would come through our research studies had a number of issues going on. So it was challenging because I was interested at the time in how does HIV influence cognitive and mental health outcomes, but then realizing that that was too simplistic of a framework and too simplistic of a question, because these people had these very rich life histories of stigma, social isolation, socioeconomic disadvantage, access to healthcare. So there were all of these social issues that seemed to really play more of an important role on somebody's cognitive or mental health trajectory. So that's when I started shifting into looking at some of these more, if you will, psychosocial factors. And because I, from way back in the day, had always an interest in stereotyping, I was actually trained initially by a social psychologist. So learning about stereotype threat and the idea of threats being in the air, it really started churning my wheels later down the line when I started thinking, wow, how could this apply to the work that I'm doing now? Which sort of led me down the path into becoming really interested in issues of racism and discrimination, particularly because most of our study participants are African American. So that's a very salient factor, part of the identity, and thinking of it as a stressor, a unique one, not one that in the general form of how we think about stress, but really thinking about racism and the potential for someone to judge you or to stigmatize you or discriminate because of that, sort of folded into my work later down the line.
So along the way, in pursuing this work, as you're saying, with groups of individuals who've gone through a lot of rich and challenging life histories and experiences, you're saying, of discrimination and isolation, what did you notice as some of your own frustrations or challenges in doing this work, as well as some successes that you've been able to savor along the way?
Sure. Well, there have been a lot of frustrations. We could go on for days about that, but I would say largely the frustration was trying to have a framework to understand all these complex issues. And there have been theoretical models proposed, particularly around social determinants of health and how that influences outcomes. And I've use that framework to think about the work that I do. But it's even more complex than that because of the interactions between all of these variables. And then it gets even more complicated when you start thinking about people who have intersecting identities that where certain aspects of their identity may be salient in one context, but then it changes. And in terms of even the social threats tied to each type of identity, largely in the population I've seen, racial identity, sexual identity, those are factors that can, intersect at various moments. So I think one of the initial frustrations was just feeling too overwhelmed, like this is too much. I don't know where to start. I just wanted to understand about brain and behavior, and I wanted it to be very simple science, and it became larger than that. So trying to tackle that, I would say, has been a frustration, but also a success in that I think we are moving in the direction of recognizing how complex these issues are. A second, I would say, frustration, if you will, or barrier initially to my work was that racism and discrimination, although it had been talked about in its connections to health, I think many people, when I would give talks or presentations, I don't really think it hit home enough of how different it really is. And I remember trying to talk about these issues, and then someone would raise their hand in the audience and say, well, but these people also have this and this and this going on. So how do you really know that this is about racism and discrimination? So it forced me to sort of go beyond the anecdotal. I know that this is a very unique stressor and very tied to social threat, and to actually study it and to really force myself to come out with data to have evidence for something that I've sort of known for a long time. So I would say that both instances have been both frustrations, but also successes.
What do you see as the most important future directions of the field looking ahead?
I think we need to focus on more resiliency factors. And I know we don't have a really unified definition for what that is, but one of my concerns is someone who does study, quote, underrepresented or under-resourced populations, is that sometimes the language used in interpretations, and I've been guilty of this too, tends to pathologize these groups. And considering these groups as risk factors or being part of this group as a risk factor, I think we have to be really careful with how we talk about that, and to really start looking at the strengths and the positive aspects of, despite all of these adversities, what are some of the key elements that keep people from actually having adverse outcomes of what we would expect. So I'm hoping the work goes in that direction, to focus less on pathology, more on strengths, because I think ultimately those will be helpful for interventions moving forward with how to address these various issues that, for the most part, a lot of these social issues are not going to go away. And people will live in adverse conditions, and we can't, unfortunately, fix that, but we can optimize mental health by really understanding what is critical for surviving through these various life adversities.
Along these lines, and my last question for you is, what advice would you have for people watching this interview today, maybe they're students or the public who are interested in learning more about maybe getting engaged in the field?
Well, I would say for students, I think this is the time when the intersection of social issues, social justice issues, and health is at its peak. So I would encourage just reading whatever they can about the topics. And for the public, I think the awareness piece is critical. And I would hope that other academics, such as, myself, continue not just to do the work, but to really put it in platforms where the public gets to see it. Because often we have so much knowledge that gets locked up in the ivory tower, if you will, because we're publishing in journals that mostly our own peers are reading. So to encourage outlets of that actually the public will be aware of, I think that's sort of one thing that I'm forcing myself to do with my work, and I would hope other academics do. With students, I think just linking to opportunities that will allow them to study these complex issues would be very helpful in the future.
Wonderful. Well, thank you so much for speaking today, April. It was really inspiring.
Oh, great. Well, thank you.